Hello, sir. Good evening. Can you hear me? Hello, sir. Good evening.
Can you hear me clear?
Yes, sir. Loud and clear.
Absolutely. Okay.
Okay, sir. I'll just begin with the introduction.
Okay.
Okay. So, hello everyone, and welcome to today's session. This is the 12th part of a week-long series of Webodontia, and these events are brought to you by the Rotary Club of the Producers, an organization of medical and paramedical students. The Webodontia is a week-long event with educational webinars blended with fun activities. And before we begin, I'd like to mention that a recorded version of this webinar will be available on our YouTube channel, and the forum for questions will be open at the end of this webinar. The feedback forms for revealing certificates will be provided in the chat box of Cisco WebEx and YouTube Live. And with that being said, I'd like to introduce today's presenter, Professor and Dr. Srivats. He is a special care dentist, a pediatric and preventive dentist. He's the founder and chairman and CEO of Vatsalya Dental Clinic, the clinical director of Special Olympics International, council member, International Association for Disability and Oral Health. Vatsalya Dental was among the top 5 dental centers in the world, and he is a pioneer in introducing home dental care and 24/7 emergency dental care. He also does a lot he also does a lot of counseling for undergraduate students for confidence building. And with that, over to you, sir.
Hi. Thanks, Pranjali, and welcome everybody. So this is a format in which I think we have some question answers that we would probably answer and address. So I'd be happy to take questions, and I think Pranjali already has a few set of questions that she may want to ask, and then we can take this discussion forward. Before I begin, am I okay with my audio?
Yes, sir, you're audible.
Okay, perfect. Thank you. So, just to give you a brief overview of how we began, thank you first to Pranjali for reaching out to me to probably be a part of this week-long webinars, or I should say, some sort of online education program that she has organized. Congratulations to you. Though you're a student, you do have a potential going ahead to be a better organizer, and I wish you all the best.
Thank you.
Uh, uh, as I did see, a lot of people have gone through multiple sessions on clinical dentistry. Though being a thorough clinician for the last 25 plus years, it's always been an itch for me to find out and figure out what is the real recipe or the essence of a successful dental practice. And that has been my intriguing interest forever, to keep myself interested in the subject, in practice, in teaching. And, you know, those were very, very important aspects to me. And largely, I've been seeing that many dentists are dropping out of the profession, or even the dental students who are studying dentistry are kind of demoralized. And so I have resolved to shift my focus, not just of being a dental educator myself, but more importantly, I think I'd like to spend the rest of my time in trying to build more confidence and trust among dentists in this great profession of dentistry. And I'm sure that most people who heard this term, great profession of dentistry, may be kind of shocked, but that's the fact. To this session, I'd be happy to address questions that are more related how do you want to take your profession ahead? What are the ingredients? And I have, for several years, being trying this sort of understanding among dentists, and I'd be happy to continue that not just through this session, but even after this. I will leave my coordinates and things like that with which people can surely get in touch with me directly, and I'd be very happy to spend my time in helping all of you. Thank you so much again, Pranjali, and everybody who have done this wonderful job of organizing this. I know it's an arduous task, but over to you, Pranjali.
Thank you so much, sir. Thank you so much. So I'd like to begin with the very first question of would you like to share your views about the stigma around dentistry in India?
Yeah. So, as far as my views about dentistry and stigma is concerned, I feel that it is not true. If we are relating, are you asking me about the fact that most people feel that dentistry is a done deal and that's not a profession anybody should pursue?
Yes.
Right. So that's a 100% misquoted statement, I would say. Because what we all need to realize is the dental fraternity's success has not yet begun in this country. It's not even begun. It's still in a very nascent stage. If you look at WHO statistics or even the least amount of statistics that's available in our own country, you will find out that at least 75% of India's population needs dental care. A WHO report says that 90% of children and 100% of adults require dental care because of dental cavities. Right? Look at television. Every fifth ad on the television is about an oral care product. Right? And so there is a very clear need for this. What is confused is the differentiator between quality of service that is available versus the expectation that the patient has. And so it is actually not saturation, but it is the quality of service that is precisely not available. And that, if flipped, will make a big difference. So I don't agree with this fact that dentistry is saturated at all. And to give you an example, dentistry, fortunately, is not a volume based entity. Like, in the sense, let's say if somebody is doing a medical practice, to even sustain their medical practice, they probably need to see 10 to 20 patients every day because their consulting fee could be anywhere between a 200 rupee to a 500 or a 700 rupee. I don't know how much it is in Mumbai. It may be much more expensive, but relatively, the real estate is also as expensive as that. But having said this, dentistry does not require that sort of numbers because we are on the surgical end of medical care. And so it is not a volume game. It is about doing one good patient in a day and you're done for it. So it is about how do you get your patient to understand that you are the preferred dentist with whom that patient trusts his or her dental care or this body to be handed over to that particular dentist so that they feel secure and safe. How do you give that confidence is the art of dental practice. And that's something that we have to learn in our dental schools. With all due respects, I think the first thing we should all stop doing is criticizing our field, criticizing our dental schools, criticizing our teachers, because I think whatever has been done with a good intention. Nobody wants to ruin the profession and things like that. But unfortunately, there's only that much that anybody can do. Imagine a government, imagine any sort of system. Why don't we start comparing ourselves with many other countries? Let's say Afghanistan, Iraq, Syria, Palestine. I have friends in some of these places who say that, can you help us come to India and practice? Because we can't even practice properly here. We have no access to doing things. They have no access to information. But we are not in that situation, right? And there can be no single person who can provide all the information. When I say a single person, it's a dental school or an entity. So, and medical practice is a lifelong learning process. So there are certain basics we need to learn in the beginning, which is what is not probably being taught at our dental schools. But we all, let's say, if I have done 25 years of practice, and if I could take a dental clinic from a 250 square feet to a 60,000 square feet dental center, which ranked among the top 5 dental centers in the world, there is something that I can contribute back and teach this to the society of our dentists or community of our dentists to enhance. So each one of us should take that responsibility of sharing knowledge with our fellow colleagues. And the day that we break that barrier, and this is a very psychological human barrier, because dentistry is an art. And whenever an art is associated, then there is ownership of that art. And then there is that prejudice that comes with that art. And so sharing becomes a little difficult. And if we are able to overcome that human angle to it and think that if I share it with 10 others, because the larger goal why all of us became doctors is because we wanted to help the society at large, isn't it? Right? And so if we keep that as our fundamental, that finally, if I'm sharing what I know, and if it is going to help another colleague of mine, and they help 10 other people who are the end users, who are the patients, then we will be able to create a beautiful bubble of healthy dentistry. Encouraged, I demonstrate this to you. I'm ready to teach you all the tricks of this fine, beautiful art. You are at the right age and time of practicing dentistry. I wish I was your age, because I see so many opportunities. I see so many opportunities. And don't ever feel that, it is saturated. It is not saturated. It's not saturated. If you even look at statistics, there is one dentist per 1.5 lakh rural population in this country. Look at the need. Even if you look at urban statistics, we have one dentist for a population of 10 to 12,000 dentists today. People today. And that's a lot. That's a lot. You don't need that kind of numbers. Even 25, 30 years from today, if you know how to do it, and if you know how to actually practice, what are the values with which you practice, how do you approach your patient care, it's going to be a very, very successful time that you will have as dentist. So please don't be discouraged.
Yes, I think that opening answer did a lot of justice to the title also. And so the next question is, does this stigma affect the professionalism in dentistry? Because the students enter dentistry with this criticism, which destructive criticism, I may say, by the society that, oh, you couldn't pursue medical because of a few marks and then you ended up in dentistry. So it is an accessory field. So does it
Right.
affect the professionalism over the years?
There are some great examples. I would actually like to quote one of my very, very close friends, Dr. June Nunn, who is the professor emeritus and who was the dean of Trinity University in Dublin. And she is almost like the mother of special needs dentistry. She actually was one of the forefront leaders who got special care dentistry into our field itself as a branch. Right? She's such a pioneer. And if you go back to read about her, she never wanted to be a dentist. She also wanted to be a medical doctor, right? I am of the same example. I wanted to be a doctor too. Not just doctor, but again, as a dentist, like everybody else, I wanted to be a maxillofacial surgeon. I, in fact, had a seat in maxillofacial surgery in India and abroad, but I couldn't pursue it. Now, there may be 2,000 reasons for it, but the truth of the matter is that a lot of limitations come. And like you said, why am I born in India? Did we have the choice? We are born to our parents. Did we have the choice? We don't even have the choice of choosing our own name. So try to look at life that way, right? It's not a bad profession. It's nothing bad. So we adapt to a lot of things. Now, let's say we look at IT professionals. Okay. Go back and see the degrees that the IT professionals are holding. Like engineers are working as IT professionals. There are mechanical engineers who are working as computer engineers. that's so much amount of distortion, right? At least it is you wanted to be a doctor and you have got a branch, a specialized branch called dentistry, which you're able to pursue. So if you look at life that way, then you're perfectly set. So be the best version of what you can be in what you have. Ultimately, that essence, if you're able to understand, then I don't think there's any looking back. Because the more you keep brooding over the fact that, oh, I wanted to be this and I couldn't be that, just go back and think. Go back and see. You can keep cribbing that why am I in not in. But I look at it as at least we're not born in Syria. At least we don't have, the problems that so many other people are facing. You have access, so there's a positive element to your life. And why don't you look at it that way? You got such a great opportunity to help people in pain. You don't need to do any charity. Just do your duty the way it has to be done. Serve your patients through 100% amount of dedication. That's about it. And so get over this aspect that there is a comparison. So let's say you did an MBBS, and then what if you got into pharmacology? And then you'll be cribbing that, oh, my classmate became a cardiothoracic surgeon and I'm a pharmacology guy. I'm not demeaning any subject, but you can be the greatest pharmacology guy who got out the best, let's say, medication for flu. Who knows? Right? So that is the way that I would want and I would encourage people to look at life. There is a true angle that you don't have control over what you can be. The only thing you can do is put in your best effort and accept whatever comes to you, but be the best version of that. Don't be discouraged. How long can you live with this? So what is the option? That you quit and become what is that called, medical prescription, or go do an MBA and become a floor manager in a hospital, go join an insurance desk. This is what people have been doing as dentists, right? Do you think that you will be satisfied there? Not at all, because people are going to look. I've heard dentists are joining cops as constables. It's totally fine to be a constable, but then don't compromise. Be the best version of that and enjoy what you're doing. Ultimately, that's the most important thing. So don't be discouraged. Go back and see how many things that you really wanted to do. And the thing begins with your choice of your parents. Second is choice of your name. Did you have access to any of these things? No, you didn't have it. So perseverance is very, very important in whatever you're doing, and do the best that you can. And you can just end this. And the more you keep listening to people, what they think of you, you're successful in life, because ultimately success is defined by how peaceful you are in doing what you're doing. And so please take this very seriously and introspect.
Okay, sir. So, do you think that we need to have a separate examination to get into dentistry in India? Because it is a very technique sensitive subject and requires specialty in fine arts from the beginning, even from the first year in free clinics as well. So, do you think there needs to be a separate examination for it?
Well, I think more than having it as a separate examination, I would be a fan of dentistry being a specialty program, and everybody does a medical program, which is your MBBS. And we all get to do MBBS first, and dentistry should be a specialty, because dentistry by itself is a specialty. And then probably all the perio, prosto, pediatric, and all that could be super specialized courses. So, in my opinion, if that approach is taken, that's going to do a lot of good, because it will also make us very sound in handling medical emergencies. It's not going to make us feel like, oh, we can't take care of certain conditions. There's a huge disconnect. Basically, dentistry somehow has got divorced from general health among medical professionals, as well as dentists, as well as the population at large. And unless we close that gap, it's not going to work. So it's like you do an MBBS and then you go on to do an ENT, then you go on to do a pharmacology, then you go on to do dentistry. And that will be a better way rather than segregating. I feel if you do a separate exam for dentistry earlier on, though it's a wonderful skill testing, but that should be at postgrad level, because you would have already gotten to understand certain basics. And there are universities that even I have taught abroad, wherein there is a stream that is merged between dentistry and medicine. Medical guys come and do dentistry, and dental guys go and do medicine. And so you have a much sound background. So this is a very important aspect. I would think that should happen. If there is a transformation and tomorrow's leaders are all of you, so you should pursue this, that we bring dentistry as a specialty course and then have MBBS as a basic requirement for anybody. That also solves the with one arrow, it solves both the problems, that you get the satisfaction of being a so-called medical doctor. So you get the degree, you get the knowledge, so you don't feel that, oh, you are in second fiddle. And then you also go on to improve specialty. So somebody who really passionately likes dentistry will advance through that.
Yes, sir, that's a wonderful idea. And the next question is, so what do you think gave rise to the stigma in India or abroad in general? Because they call dentistry as a very barbarous profession, a very cruel profession, if you may say.
I'm not really sure if I have personally heard these terms about dentistry, whether in India or abroad. Uh, but I feel that it is the same even with certain medical professions. I've heard a lot of my friends talking about orthopedic surgeons like that it's a very crude science. And so any surgical branch generally comes under this unless until you make it really life threatening and important, like cardiothoracic surgery. So there are biases among every single specialty in every single thing. Only the worldview. The reason why this has come into being is because of the high level of skill that is involved. Like I always told, let's take about anything. How many great performing musicians do you know who are great teachers? How many great tennis players do you know who have become great tennis coaches? Right? So the answer to that particular question itself. So there is an inherent tendency, because you are a performing person, so you're busy performing and you're not concentrating on teaching. And unless there is that paradigm shift where we say that, I want to combine the two and then nurture young people. And I already said that in my opening remark, that unless until good practitioners are open to share the real secrets. From 1990, I've been listening to this, how to do anterior composite restoration. How much more will you learn that? Right? How much more? And there are umpteen number of and programs that have been completely focused on just teaching people skills. I'll tell you an example. Patients who are the end users, whether dentistry is saturated, you'll have your answer there. The stigma is not there. The stigma is within what we are trying to create. So make that change and ensure that we actually practice what we are practicing is taught to youngsters and allow them to practice. So we should set that barrier properly, and this will go. I don't see a big problem at all. It's about a mindset change. Every profession is good. Every profession is good, Pranjali. There's nothing like that. Name 5 good maids that you have had in your home. There is Uber, there is Ola, there is so many car services. But are you happy? Do you feel secure? You don't. It's got nothing to do with this. Go and talk to them and they'll say there is, oh my God, I don't want to come to the airport because it takes three hours for me to get the next ride back in. There is saturation everywhere. But is there saturation for good people? No. There's always room at the top. And that should be your pursuit. That should be your pursuit. There's always room at the top.
Okay, sir. So, what do you think is the role of discipline in becoming a successful doctor?
I think that is a million question. I've learned it the hard way. I'll give you a real example. So, globetrotter at one point in time, until I got this crazy thought that I was too selfish about myself, doing everything, and I could have had the opportunity to settle abroad and for a PhD at McGill University, which I somehow decided not to take it because of this passion to change what's happening here. Because after traveling so far and wide, I did notice that Indian dental students and Indian dental graduates were really brilliant. And if they were going there and performing, why is it not possible that we can perform here in our own country and change the ecosystem here? And so that's the vision and mission that I carry now. So I stayed back in India, and I've been trying to teach at various dental schools and privately teach or coach students and dentists to achieve their best. So in my very first outing abroad, I was in a conference, I was speaking. I met somebody with whom I went and said that I need, uh, to do some research activity. When I went and spoke to that lady, she was a European, and she told me that I don't have time for the next 6 months, but let me have your coordinates. And I said, what is she telling, that she doesn't have time? And she took down my number and email address. And she's saying that after 6 months, we will think about it. And I was booming with ideas and booming with so many concepts that I could do. And I just discarded her. I said, to hell with her. Oh, she did whatever she did. Exactly 6 months later, I got an email from her. And she said, I'm done with all my projects, and I had slotted your appointment 6 months later to discuss this project with you. Are you ready? And I had done nothing in 6 months. That I would do everything else and to hell with her, and I will come up with my own projects, and I had 10 ideas. No. So discipline is a very important thing. And that is when I learned that to be organized, to be committed, and to be very, very involved with what you do is what it takes to be successful. It hardly takes talent. You can find a lot of talented people, but if you don't have the discipline, if you don't, discipline gets you to perseverance. And if you have perseverance, there's nothing like failure. You will 100% succeed, because ultimately nature has to give way. It will give you a chance. And hard work is the only way. Nothing comes easy. Nothing comes easy. To build a reputation, to build success is not easy. Is not easy, right? And so discipline is one of the first and foremost important things. Discipline in your mind, discipline in your actions, discipline in your practice, and discipline in every single thing that you speak. The first thing that we need to learn, there are four components that you have to be very careful, because as a person, you are representing yourself, you're representing an organization or an association, you're representing a profession, and you're representing also your family. So what you do, how you speak, how you behave reflect on these things. If as dentists we don't look like dentists, we don't speak like dentists, we don't behave like dentists, everybody is going to talk like this, isn't it? So we're seeing today in the news media that there is one profession that is simply being criticized for some misdoing by one or two people. And that's how society judges people. And so we have to be conscious. If you go back and see any aspiration or passion that you have developed, it is not because of anything, but you have probably observed some of your neighbors who have, you would have seen a very neatly dressed person going and very having a good decorum when he's talking to people. You imbibe that, right? So we are constantly influencing people around us, and we are constantly imbibing things from people around us. And so it's very, very essential and very important to have that discipline. And that's the only way. Look at any successful person. Any successful person. I'm very happy today the session started on time. You have to be 5 minutes early. And this is a very good thing. You have to be organized, you have to be disciplined. And that is what success will come to. You can't allow your patients to be waiting for you. There was a traditional time where, patients would be waiting for a doctor, and doctors will come half an hour late, 45 minutes late, 2 hours of waiting. No, everybody's time has to be respected. And so if you are early and if you're making sure that everything is happening on time, then it makes a big difference. So discipline is the only way to success.
Hello? Yes. So while we're on this page of discipline, our next question is, what are your tips on increasing productivity in the lockdown? Because all of the students are stuck in this rut where there are online classes, and there is this feeling of, there's this overwhelming feeling where we don't complete as much as we plan, and we kind of lag off. So what are your tips on increasing productivity?
I think I think the lockdown has been a boon to increase productivity. I feel so. I've never used Zoom as much as I've ever used now. Right? Imagine I wouldn't have been able to reach any one of you if not for technology and this particular entity of the pandemic. And more importantly, I think to increase your productivity, I think set a routine. Please put a timetable. It might look very childish, but start doing it. Put in a timetable, start prioritizing things, and most importantly, learn what is most important. Procedures are important, but there is something that is more important than procedures. How do you think a patient who listens to what you say chooses you as the dentist? What is that ingredient that makes a patient get up from the consulting chair and move to the operating chair? What is that element? You can be the best skilled person, you can do a root canal the best way, but the patient never knows about that, right, until he goes through that. And there are lots of issues that can go wrong even with the best people. Sachin Tendulkar can get out at zero, there's no assurance. Then what is it that saves Sachin Tendulkar from criticism? Think about it. It is his reputation. How has he built that reputation? It is discipline, it is practice, and demonstrating his credibility every single time. And that is the essence of practice. And if all of us are open to learning this with an open mind, just because it's not taught in dental school doesn't mean that you don't have to learn it. And we don't have to criticize dental schools and teachers because everything can't be taught at every place. And so it is our ardent duty to make sure that we make that effort of learning. And there are people who are willing to teach. I am most willing to teach that. And so please put in that time and log in, and then you will start seeing, take small baby steps. Take small baby steps. And the first and foremost thing is setting a goal. The moment you set a goal, nothing is difficult. Right? When I look at these mountain climbers who climb Everest and all that, I feel, my God, how are they even doing it? I find it so difficult to even imagine, right? But then they are joyful about it. I see people running marathons like crazy, like 40 kilometers and 20 kilometers and everything. I saw some marathon that's happening for 100 kilometers next weekend. And I was like, wow, 100 kilometers of walking or running? Unbelievable. But they enjoy it. And for me, it's stressful. So it's that perspective. So the moment you set a goal to yourself and start taking those steps towards achieving that goal, every step that you take and every difficulty that you face towards it, you would only enjoy it and look forward for it, telling that, okay, this is one more step. When you're climbing up one step, breathlessness gets you to closer to your dream. And so it's very important. Most of us don't even know what we want to be. Ask yourself this question: what is your goal in life? Write it on your wall and look at it and stare at it every single day. And you just need to ask yourself this simple question: everything that you're doing at this point in time, is it in line with your goal? If it is not, don't do it. Simple, right? So all of these things will come by itself. There's nothing that I need to teach you to be. I can't motivate anybody. You can only wake up a person who's sleeping. You can't wake up a person who's acting to sleep. So as long as you are driven by your own passion, it is impossible to motivate anybody. I can't bring in a discipline, right? So I had an experience of this, wherein, when I was running a large team, there was this constant thing about, please come on time, don't keep your patients waiting. But then there were people from all over the country. And so one day I booked a rock show for everybody. There was a rock show happening in Bangalore, and I booked a rock show. People who didn't know each other, people who never were in Bangalore, coordinated everything, booked Ubers, booked cabs, reached every place on time, got dressed up, and even at late night at 1:30 in the night, they all dropped each other to their destinations and came back. How did that happen? Because of interest, that you wanted to do that. And so there's nothing like I can or anybody can introduce anything. You can only follow your heart. So do things with that heart in place. Fix a goal, the rest will automatically happen. And be happy in whatever you're doing. It will happen. Yeah.
Right. So another question that we received was how to stay motivated through the 5 plus 3 years of dental education in India.
As well.
Yes, sir.
So, uh, how to stay motivated? There's your motivation should be in the beginning. I think it's very important when you choose the profession. What you can do is a little bit of research. I would always encourage you not just to talk to professionals who are dentists before joining a profession or any profession for that matter. If you're joining dentistry specifically because this is dentistry, asking about the profession and things like that. I don't know whether you'll get the right answer, but just in case you want to do a little bit more research before you enter this particular branch, I would strongly encourage all of you to go and meet random regular people. Go and talk to your neighbors, go and talk to your friends, go and ask them what is it that you expect out of a dentist, right? If they give you answers like, you know what, if I get a midnight pain and I want my dentist to be available, ask yourself, are you ready to be that? Ask yourself, am I ready to forego my Sunday holiday? Ask yourself these very tough questions and only then enter into it. Then there's nothing like you have to be passionate and things like that. So every profession comes with its own disabilities. Look at our army people, right? Why should they be taking bullets and why should they be sleeping all night with their guns in those grasslands with scorpions and snakes surrounding them and keeping a guard and vigil on our borders? Why should they be doing it? Because they chose to do it and they knew that this is what it comes with. So if you're able to do that research in your own life before you enter any profession, that will do a lot of good. It'll do a lot of good. Just don't join dentistry because there are no night duties. Just don't join dentistry because I can have my own clinic and then I don't have to be answerable to anybody. There's no such concept. And don't think that I don't need to work with anybody. I can have my own timings. These are wrong parameters by which we are entering this field. And don't join dentistry because you didn't get medicine. These are not the things. And if you entered it, be the best version of it. No, otherwise you just imagine there might be one candidate who didn't get into this dentistry also. There's one level below also. Maybe they went into Ayurveda, right? Who wanted to be a dentist. Imagine how we are spoiling the whole thing. So be responsible for what you got. Don't throw it away. It's like people saying don't commit suicide because life is so valuable, isn't it? So make the best opportunity that you have. So it'll do good to yourself, it'll do good to the community, and you will be very, very safe. So there's no need to be motivated. And if you have some of these basics in place, you're done. It's not true that IT professionals are all happy. Please go and do a survey. I found out that 85% of people who are working don't want to do what they're doing. So it's a fundamental issue with how we deal with the profession and how we live life largely. You don't get, you're all very young. Trust me, I have yet not got what I aspire for. I have yet not got. And most people are successful. I'm not successful, I feel, according to me. I feel there's so much more to do. And I'm longing for those opportunities. Like I want to teach whatever I know, right? And that gives me encouragement. But how many people want to learn? It's not easy. So you have to have that perseverance. So only you can drive yourself.
Yes, sir.
Positive. Develop the attitude of gratitude. Having gratitude is very important. Very, very important. Opportunity to study dentistry. Thank that. Okay, great. I at least got an opportunity to study dentistry. So many of my people didn't even get to study this. Imagine the responsibility that you have to treat a patient, right? Imagine if the patient was your mother, if the patient was your father, would you just do the same treatment that you're doing? So what's here, right? Do unto others what you would like to be done to yourself is things. So automatically everything will fall in place. Personally, whenever I consult with a patient, when the patient opens his mouth or her mouth, I look at that mouth as my mouth. Very simple. what will I do as a treatment plan to my mouth will be the best treatment plan that I can ever give to a patient. This is as simple as that. You will automatically start going and looking for the best treatment plan. You will look for what is the best, radiograph you can shoot. Everything will fall in place. Nobody will be motivated by money and position and other things. Those are all frugal things which just get washed away over a period of time.
Yes, sir. So, how should one deal with patient dissatisfaction?
Let's start to do more with communication. Patient dissatisfaction probably relates to so-called improper outcomes or the gap in expectation between the dentist who's performing that procedure versus the recipient who's the patient. So probably you did a procedure, let's say it was an aesthetic procedure, and you did an anterior composite restoration or something, and 6 months later the patient comes back saying that he's unhappy, right? So this relates to communication. It's not more of hand skills alone, but this relates to communication. And this is what I have always been pursuing, that this is what you need to learn. Have you made sure that you have given all the information, which are even negatives of that particular procedure to the patient? Have you set the expectation right? And that's what is the most important thing. Missing tooth, what flashes to your head the moment you have to replace it? An implant. It's been grained into our brains, right? That the moment you see a missing tooth, you have to drill and put in an implant there, right? But how many of us talk about failed implants, infected implants? How many of us tell our patients about the risk of file breaking while you do a root canal therapy, right? The same thing has happened even in dentistry. How people told us that you're entering a profession which is not theory, but which is a practical science, and that you need to do a lifelong effort to keep sharpening your skills. Nobody told us. We all thought that the moment I get a degree, I throw my hat in the convocation ceremony, take selfies and pictures, and I'm done. And I'm a doctor. And the society at large, what is psyching you is because everybody around you is feeling that you're a doctor. Internally, you don't have the confidence that you're lacking that confidence. And so there is a disconnect. And that is the frustration that you have. That is the honest truth. So why don't we accept it? The moment you accept that I don't know enough and I need to learn, put that ego aside and go behind learning. And you will see very soon that instead of hiding behind some barrier curtain that you have created, imagine the disservice it is going to do to patients, because just because you can't perform a particular thing, you don't even bring it up in front of a patient. And so you do what you know. And then what happens? Patient goes, there's a failed outcome, and then somebody else says this could have been done this way, and then the patient comes back to you. So you need to set the expectation right. And the first and foremost thing in your life is to say, if you don't know, say, I don't know. I will seek help. There's nothing wrong with it. Patients will appreciate it. I, to this day, take at least 3 opinions of a particular. If I'm really confused, I tell the, you know what? Let me get 5 opinions on this, and let's hear what. Ultimately, it's for your good. It's not for my good. And so that's an important aspect, because all of us cannot know everything. It is impossible. Knowledge is such. Nobody knows everything. And so in the best interest of the patient, if you have done this, then patient will appreciate, even in case there is a failure or the patient is dissatisfied with the outcome, you will not face these barriers in your practice. Yes. And
Right.
I should not take away the credit. Even after you do all of these things, you may still have a patient or two who will, and those are people who have personality issues, and you have to
Right. So, as a special care dentist, you must deal with patients with intellectual disabilities on a day-to-day basis, where communication can't be established. So, what if a general dentist comes across such a patient? What are some basics that BDS pass out needs to know?
Okay. So the first thing first is please refrain. All of us must refrain from using just a BDS, dentist, graduate test, and things like that, because I feel that degrees don't make you better. Dentistry is a beautiful art. A lot of things I have learned from general dentists. I myself call myself a general dentist. I don't want to call myself a pediatric dentist or a special needs dentist, because skill is something that you cannot acquire by degrees. But having said this, whenever in practice who encounters a person with any sort of disability, the first and foremost thing that you have to look at is how is it best that you will make sure that the patient is comfortable, right? And second is how are you going to keep things minimal invasive? Of course, then the communication shifts from the patient to the family. We do a lot of treatment talk with the family. Ultimately, you have to bind the entire family's consent, in one sense, that you may have to use this word if you have to, because I have found that even one of the parents out of the two may not be willing for what has to be done. And so that bit of communication and clarity has to be set with this particular case that you're going to deal with. And you have to be a great human being because you have to feel the pain. So to give you an example on how I actually pioneered home dental services for special needs patients, is one day I was practicing and there was somebody who was waiting outside my clinic for almost 2 hours. And I saw that that person had gotten a 21-year-old person literally, holding on his arms. The father had got the daughter and they were waiting for 2 hours. And that pained me a lot. I said, what kind of service are we providing? Because if you traditionally go back and see, even if you look at old movies, if a patient is sick, they would say, go, please call the doctor home, correct? And that was the traditional way medicine was practiced. But our minds changed because we started calculating the traffic and how many patients will I be able to make more money. I can do this, I can do that, I can be more efficient. We started blinding ourselves with all of these things. But the truth of the matter is, you should be available to serve your patients 24/7 in any situation at any degree. Does that help? I'd be happy to share more insights if you have any specific question on special needs.
No, sir, no, sir, that was enough.
So
So,
I'll tell you.
that being said, yes,
I'll,
yes, sir.
I'll tell you an instance what happened. At 10:30 in the night, I got a call from somebody who was traveling with a special needs person. They had stopped on about 60 kilometers away from Bangalore on the Mysore highway to have tea or snacks. And the special needs child fell out of the car and had an injury on the head. What are you going to do? Right? So I told them to start driving towards Bangalore, and I started driving towards the Mysore road. And I met them on the highway, because it's not about telling them to come to Bangalore, because then that's a 1.5 hour journey. And so you can reduce that by 45 minutes if I travel halfway and they travel halfway. This is what is essential for a doctor. And please learn that. And once you start enjoying it, the satisfaction that the parents had, that okay, there was a dentist who came and all the front teeth were mobile, and I did a splinting in the car on that particular patient, right? But that is so important that you address those issues on emergency, and you give a first aid to the forehead that was having a bruise and things like that. And I did not come back. I traveled with the family in that car. That makes a big difference, right? And that is how you must practice your dentistry. It's not about a transactional service. You're treating a human being. And so you have to carry those values of human values. And that's the first and foremost thing. You have to be a good human being. And that is when you start touching lives. And that will mitigate all your problems. all your problems. Go back and against medical legal cases, even in the United States. They say 95% of problems can be mitigated if you develop good rapport and communication with your patients. If your consulting is appropriate and if you're a good human being, it mitigates a lot of things. If not, then you're in for trouble. Sorry, you were asking me something, Pranjali. Go ahead.
Yes, sir. So that being said, do you think communications and soft skills need to be taught from an undergraduate level to us?
Well, you see, there's a big. I'm not sure if most people understand what is communication. Communication is not good English alone, and soft skills is just about your how you receive people, and it's not that. It's beyond that. The difference between communication and articulation. Both have to be right. There is a big difference in what is articulation. So yes, I do definitely feel it has to be taught on the dental school. This is something that can be learned by you. Even if they teach you, the biggest disability that you have is that, let's say you are taught this in your dental school. But then look at the kind of patients who come to dental schools, right? They are not the kind of patients with whom you will actually do your practice. So it will fail even there. So it is on you to learn that. It is on you to learn that, because the kind of people who come don't even expect you to do what you're trying to tell them and do those things at the dental school level. Because somebody who's coming to the dental school to be experimenting with students treating them has given up all hope because probably of his monetary status and things like that. And he doesn't care about anything. He just says, just do whatever you want. And he does not have the bandwidth in his mind to understand why you're doing, what you're doing, how you're doing, and things like that. They just want the pain to go. And they believe you. So this is another thing that you need to learn. It is up to you to learn that. And second thing, please thank all your parents and your teachers. But most importantly, take a picture of every single patient whom you treated as a student and frame it up and make a collage of practices, and every day please thank them for giving up their bodies to you to be treated by you. They are the greatest people who taught you. Have that gratitude for them. I think anybody in this session would be ready to go and get a restoration done by a 3rd-year-old. Imagine what we do. A small pit cavity, we enlarge it into a class 2. When is this going to stop? Would it on our teeth is the question that you need to ask yourself, isn't it? And as young leaders and leaders of tomorrow, you must do these things and reform these things. You
Yes.
possible to augment these things.
So
Yes.
self-education is more important than a formal education, all in all.
Absolutely, yes. Today, I personally don't believe there's need for formal education beyond a certain point, right? Everything can't be taught in school. Just imagine I'm seeing ads like start teaching your children coding sitting at home, some IT coding and things like that. So you have to learn, you have to develop skills. Everything can't be taught. It is impossible to be taught. We have to be very fortunate that we have so many dental schools, so many teachers, so many people who are putting their help and direction in which they are doing whatever they're doing. And the rest of it, you need to find your way out. If you want to be that dentist who's outperforming everybody else, you have to find your way. And those are outliers. You have to have that drive within yourself for the rest of your life and practice.
Okay, so I think that was the last question of the session. So,
Thank you so much. My email address is specialsmiles@gmail.com. You can also find me on LinkedIn, and I would encourage any questions that please contact me on this number of mine as well. And anybody who wants to discuss further, wants to, I can't say learn, but wants to share all my experience that I have in more specific questions, I hope people got my email and phone number.
Yes, sir, it's in the chat box, and we'll make sure to leave it on the WhatsApp group as well.
Absolutely, that'll be really Anjali. But thanks for giving me this opportunity to share my thoughts. I really appreciate that. And also, I thank everybody who attended this. And one last thing before we leave this session, don't be discouraged. Trust me, dentistry is an awesome profession. The success of this profession is yet to be seen. And be really a booming profession. We are going to be the forefront leader in healthcare. In the next 20 to 30 years of healthcare can be dominated by dentistry if we all understand the basics and if we all get to that understanding of what is important for us and how should we practice dentistry, not just procedures. Trust me again and again on this. It's not about procedures, it's something beyond that. Learn that art of practice is what we can really learn to.
Yes, sir, I'd like to thank you for taking time out for us on a busy day, and I'm sorry for for the delay in the beginning. And yes, so this session was really helpful, and I'm sure it would help a lot of first years who enter dentistry with a certain uncertainty. And I hope it helps a lot of people out there. And thank you so much, sir. Thank you so much for today.
Absolutely. My pleasure. Thank you so much. All of you stay in touch anytime if you ever feel discouraged. If you feel like talking to me, that's my personal number that I have given, and that's my personal email ID as well. Please reach out. Don't brood within yourself and don't keep thinking that you're in a lost profession and things like that. Trust me, I will show you success in this profession 101%. Right? Don't be discouraged. It's a great profession. All the best. God bless. And thank you so much for your time. Bye bye.
Thank you so much, sir. Bye. Chanchal, can you take over?
Just minutes, I'll start the live streaming and start the